Hello there and welcome to module 2 of this course. Today we are going to be talking about what public health is, but first let me give you a quick background to my journey. I studied microbiology at Babcock University, finished in 2017, and in 2018 I started a little project that I called Live and Love. Live and Love conducted needs assessments and I evolved into communal health support scheme, which you are a major part of. And if you don't know about communal health support scheme, I will be telling you shortly what we do. One organization ensuring safer, longer and healthier lives. Yearly, millions of people around the world die from preventable causes, especially in rural communities. Our responsibility is to forge partnerships with other leading non-profits and organizations to spread effective strategies and campaigns, as well as properly monitor and evaluate outcomes to further improve healthcare results or healthcare outcomes. We seek to improve health systems as well through people and data. We strengthen healthcare systems to actually deliver the prevention and treatment of diseases in populations. Now, let's talk quickly about qualities of a healthcare system. A healthcare system should be responsive. A healthcare system should be efficient. A healthcare system needs to aim for quality and safety. The only way to achieve this is by investing in strong and effective regulatory and monetary systems. A healthcare system should also be concerned about access and coverage. Healthcare isn't for the rich. Healthcare isn't for the poor. Healthcare is for every single one of us. It's actually a utility. And health systems must be concerned about social and financial risk protection. This is about ensuring that access to healthcare is affordable to the population. Are you wondering what a healthcare system is supposed to do all of this? Do we even have healthcare systems here in Africa or here in Nigeria? Of course we do, but they need to be strengthened, and this is where myself and yourself come in. So to go further in this course, we're going to now talk about public health, and we're going to talk about 4 major steps you should take when conducting any assessment or carrying out a healthcare project so that the healthcare system can be strengthened in order to provide care to the population. Public health is first known to be the science protecting the safety and improving the health of communities through education, policy making, and research for disease and injury prevention. Public health quality outreaches have 4 phases. The first phase is called needs assessments phase. Here you have to ensure that you go into a community and then you analyze what their needs may be. Sometimes we think mind over matter. I feel like this is the problem, but that may not be the case, and this is why it is important that you go into the community, know what their needs are, and then figure out how you can solve this problem, which now takes us into the second phase of planning a project. Planning, I already said it. Here you now look for resources that would work. You look for people, you look for what needs to happen here for me to make a change. And after you've planned, after you've analyzed and you've structured everything perfectly, you then go to the third phase, which is the stage of implementation. At this stage, you must be concerned with ensuring that your project is well implemented, it is well adopted. If you need to leverage on stakeholders, if you need to leverage on community leaders, do that, and then evaluate, which is the last phase of the project. After you evaluate, it would make you know as a public health practitioner if your project is successful or not. If it is, what worked and what could you improve on? And if it didn't work, that is still not a failure, because other people would learn from your experience. So it's important that you document and then state the limitations, state the expectations, state what you've observed, so that someone who wants to carry out the similar projects can go a different route because you have properly documented what worked and what didn't. In summary, public health focuses on the needs of population, unlike medicine that focuses on individuals. Public health is also concerned with determinants of health. It is concerned with equity. It is concerned with interdisciplinary and intersectorial factors. It is also evidence-based. See you in Module 3.